February 24th, 2021, and over 500,000 people have died from the COVID infection. Black and brown people have disproportionately been affected, have died, yet many black and brown people are choosing not to get the vaccine. We have a problem, and maybe we should take the time to listen. I have a very special guest with me today, Lisa. Lisa, how are you?
I'm doing good this morning.
All right, so I have a couple questions for you. All right, I want the people to kind of get to know you. Are you a African American black woman?
Yes, I am.
And are you older than 40?
Yes, I am.
Okay, and do you have any health issues?
Yes, I do.
And do you have any children?
I have four children. Four, yes. All adults.
Grandchildren?
9.
Oh my. Okay.
Mhm.
And have you had the COVID infection?
No, I haven't.
Has anyone that you know had the COVID infection?
Yes, all my children had COVID, and one of my cousins lost his wife due to COVID.
So, do your children live together?
No,
Okay. And did anyone offer you or your children the COVID vaccine?
Well, I was offered the COVID vaccine.
You were offered the COVID vaccine?
Yes, I was.
Um, and did you take it?
No, I didn't.
Can you tell me why not?
Well, I'm really afraid of taking the shot. First of all, I've seen people. Well, this one person, I'm gonna say, she attracted Bell palsy from the shot. Also, I've been hearing people have been getting sick, but that's not so much as really why I'm not taking it. I'm not taking it because when Trump people stormed the Capitol, so many white supremacists came out of the closet. I'm talking in the medical field, the police, firefighters. They even seen the noose hanging in a firehouse. Nobody wants to say what firehouse it was. Like somebody hung it there, and these the people that you depend on. You should depend on every day for stuff that you need. Like I'm at a point right now, I don't think that I would even call them if I needed them. Afraid that in my issue not being handled, I end up going to jail. Like I just can't trust the people I should at this point.
So, do you think this is new?
No, you know
I
what?
mean,
I
you
really
said,
go ahead.
go ahead. You're 40 years old. You've had encounters with doctors and police officers in the past. So why is this different for you?
Because in the past, you could just assume what they were because of their actions. Now they came out the closet, you pretty much know how they feel about you as an African American person, period. Men, it's even worse. I have 3 sons, and I fear for them every day because of what's going on. I don't think it's new at all. As a matter of fact, I know it's not new.
Hmm.
However, people are coming out now. They showing you who they really are. And I'm scared. My doctor is such like ever since I met the lady, she's just been very judgmental. Um, she say things that's inappropriate for a doctor to say to a patient.
Can you give
So
me an example? What do
okay,
you think that's inappropriate?
um, okay. So one time I had surgery, and I had some blood clots during the surgery. So I needed a medication called Lovenox, the shots. So I was looking all over for the Lovenox shots, but I couldn't find them that night. Prior to that, she had synced my record and she synced where I had painkillers. So she said to me, um, I've had, she put on my medical record that I was like I think some words along the line of chronic pain user or something to that effect. I was mad because I asked her to take that off of my record. First of all, she never prescribed not one pain pill to me. Second
Mm-hmm.
of all, if she would have looked through my record, she would have seen every time I had pain medication that I had a serious surgery. I was in the
Mm-hmm.
process of having my sweat glands removed.
Mm-hmm.
So she said to me, um, when I asked her to remove that off my record, that I didn't spend 12 years becoming drug free for something like that to follow me down the line, which she
Mm-hmm.
wanted for her. And so we went back and forth for a little while, which one was very out of order,
Mm-hmm.
unprofessional at its finest. Then she said, "Who was it that stayed up all night looking for you some Lovenox?" First of all, doctor, you prescribed it. I don't know nothing about it. But the whole thing is, who would say that to their patient? I don't
Mm-hmm.
trust her. I believe, this is my own opinion, I
Mm-hmm.
believe she's very racist.
So why not switch doctors?
Because when I tried to switch her, they were saying something to me to the effect of, why do I want to switch her? And I said, we don't get along. And they said they could see if I wanted a male doctor, but I'm trying to switch to another female doctor, which didn't
Mm-hmm.
make pretty much sense. I went to patient relations on this lady and everything. They fight for each other. Simple as that. I really didn't have no pull, but I wasn't going to sit back and just take it.
Okay, but back to the COVID. This doctor isn't the one offering you the vaccine, correct?
Right, correct.
And like you said, you've had surgery before.
Hmm.
You've received care. Now you feel that the racism is more obvious than before, but you also know that people can die from COVID.
Yeah, I know that.
And so you would rather die from COVID than get a vaccine that could potentially save your life?
Well, I ain't gonna say I'd rather die from COVID than get the shot, but I don't trust the shot. So I could get the shot and I could die from that. Because first of all, again, I say I don't know who putting the shot in my arm. At this point, Caucasian people, I can only trust a few. Like I can count on one hand how many I really trust at this point. I don't trust the doctors no more because I don't know who is who, what they, what they rocking with, if they like African Americans. I'm just paranoid, period. I'm scared.
Mm-hmm.
I think they might inject the shot in, I mean, the COVID in me, just, using me for a guinea pig. I can't trust them no more.
So you think it's possible instead of getting a vaccine, you might be getting the COVID virus?
Yeah, uh-huh. I kind of believe that. Yeah. How do I know? I'm not a doctor. I'm not a nurse. I don't know what you putting in my arm. I know what you say you putting in my arm. But at
Mm-hmm.
this point, the only way I would even consider getting a shot, it would have to be administered by an African American because I trust them right now. I trust them right now. And it would have to be somebody that I knew loved their job versus hate people. You know what I'm saying?
No, say that again. What do you mean by that?
I mean, like, they love their job. They there because this is what they love doing. And they want the best for patients and, you know, They want to comfort patients. I don't need somebody in my face smiling when all the time they gritting their teeth because they can't stand helping me.
Mm.
I don't need that. And I don't know if you that person that's gritting your teeth because you can't stand helping me. It makes me look back in hindsight when, like a lot of times I had surgeries or whatever, and different nurses or whoever come in the room and talking, with demand, instead of being patient with the patient. I look back then and say, I wonder were they, you know, um, racist? Did they not want to help? I remember having surgery on my knee with the aide in the room, and I was trying to wash my body better. And I stood up and hit the floor and bust my leg back open. And she's standing on the other side. And I'm on a fall risk. First of all, I was on fall risk. They didn't have no fall risk things on my door and all that. But once I fell, then they start putting everything up, trying to cover their butt. And I noticed too, because I'm not stupid at all, I start being transferred to they smaller campus to have surgeries. One, probably because I'm a fall risk and they feel like I don't follow instructions. Two,
Mm-hmm.
is because they want to cover up what had happened. And that's just sad. Like, you got to be afraid of the people that you wish would help you the most. Now COVID is out. You got to go to the hospital by yourself. You already scared. Then you got to intertwine with somebody that you don't even know if they give two hoots about you. And then after that, you end up dying by yourself. You know what I'm saying? That's some scary stuff.
Mm. So let me get back to, you said you would feel comfortable if a African American administered the vaccine.
Yep.
Now, I'm sure you've seen pictures of African American doctors getting the vaccine.
Yep.
That doesn't reassure you?
uh-uh. I don't know who gave them theirs. They probably gave it to themselves or something. Like, I bet you, like, if people wasn't afraid of losing their jobs or whatever, the ones that can't stand this kind of behavior really wants to speak out, but just holding back. You know what I'm saying?
Are you saying that some of these African American doctors are getting the vaccine because you think they might be afraid of losing their job?
Yeah, I think they're getting it because of that. And then too, maybe they doctors, so they have a little more knowledge than I would
Uh-huh.
about the vaccine. But at this point, my trust level is so low with the people that's got to give it to me, till I don't even think about catching COVID or what's gonna happen if I do. Like, I don't think about that, because it just stresses me out. My anxiety level is off the chain when I think about I have to go into a clinic or a doctor's office or a hospital.
So you're less anxious if you just put it out your mind.
Yeah, I'm less anxious if I put it out my mind. Now, I have a sister that's a nurse. I have a niece that's a nurse. I wish they could give it to me, but I'm sure they're not going to let them give it to me. But other than that, I don't think, if you could give it to me, I trust you. Yeah, it probably would happen because I trust what you say. I never met a doctor like you, Dr. Rahman. I've been knowing you for 31 years.
Oh, a long time.
Yes,
Yeah.
a long time. And all I ever received from you was comfort and love, and how you made me feel better when I had my son that you delivered. I don't find doctors like that anymore. So yeah, at this point I'd rather be with an African American doctor. And I rather, for if I decide ever to take a shot, it'll have to be administered by somebody African American. That's just the bottom line.
All right. So you're saying you would not say never. It just has to be given to you by someone that you have. at least some trust in.
Right, some trust. Yeah, I'm saying maybe like I want to get the shot because I do know well what everybody's saying that they glad they got it. Some people didn't get sick or whatever, but I'm just I don't know because Trump was in office when all this happened, and that man did some crazy stuff. It's just so hard to trust. He really got in my head, I believe. And so after I seen everything that went on, how powerful a human being can be over somebody else's life, like, yes, that scares me. And I don't want no parts of that. So I couldn't trust him to protect my life on the streets. You think I want to trust him to or I know he ain't in office, but something he had anything to do with going in my arm? No, I doubt it.
So, do you think you're less concerned about getting the vaccine because you said all four of your children had the infection
Yes.
and all four of them actually recovered?
Yes.
So, are you thinking the COVID infection is really not that bad?
No, I'm not thinking that at all.
So, you're taking it serious.
Yes, yes. I'm scared of the COVID. I don't want to get it. I washes my hands. I wear my mask. I don't go in crowds, and stuff like that. Like I'm doing everything I can to prevent from getting the COVID, but I know it's serious. And yes, I have a big fear of getting it. But I guess the fear ain't as big as me getting a shot by somebody I don't
Mhm.
trust.
Mm. So, what would it take to make you start to trust doctors again or trust the healthcare system again? Because it sounds like something got broken, maybe as a result of Trump or maybe as a result of seeing, like you said, white supremacists kind of taking off their making themselves known. What would it take to make you feel comfortable with healthcare again?
I don't know, Dr. Rahman. Uh, mm, I can't even think that far. I don't know what would make me comfortable again. Like I don't know. I just know that I would probably have anxiety, almost an anxiety attack, just having to think that I had to go and let them do something because I'm having anxiety, like just talking about even anticipating going to let somebody do something for me. And yes, I do be needing a doctor. I be having flare ups from one of my conditions, and I,
Right.
I I need to go and get it taken care of. But because my level of fear, I sit and I suffer with the flare up, and I
Mm.
just suffer. And when it do what it do what it do, and I try to take care of it the best that I can. I've been having these flare-ups for a long time, so I kind of know what to do for myself. And like I said, I have a sister that's a nurse and a niece that's a nurse, so, and a friend that's a doctor. So when I need help, I go amongst them three people, you and my sisters, and I get what I need. So, and I trust what y'all say anyway. So, when they tell me something, I just get a second opinion from you or something like that. Like, I don't just take what they say and go ahead with it. I just don't do that.
Do you know how your sister, the nurse, feels about the vaccine?
Um, I'm trying to think. Did she go get one of them shots? Um, I don't. I really don't know how she feel as far as the vaccine. I'm not sure if she gotten one yet. And if
Mm-hmm.
my mind serves me right, I think she said she might not be taking one. I'm not sure. She's retired and she has
Mm-hmm.
very bad medical issues too, underlying
Mm.
issues. So I
Mm-hmm.
I really don't know how she really feels about the COVID shot. I mean, the vaccine, but I mean, even if she did go get one, it wouldn't make me go get one.
This is sad. I mean, it's sad because it's really not, we're not really talking about the vaccine here. We're talking about healthcare in general and the fact that you don't trust it.
Right.
You know, you don't trust it. And just seeing black doctors getting a vaccine in their arm doesn't make you feel any more comfortable. So something different needs to happen, because it doesn't make sense for you to just deal with whatever you're dealing with until it gets to a point where you can't deal with it, and then you end up in the very place that you don't trust.
Correct. By myself.
That that doesn't make any sense. It doesn't make any sense at all. So what are we going to do?
Well, I don't know. I think the people need to step their game up. Start showing that who they really are. Like, come on now. If you don't want to be bothered with every nationality, then I think you need a different job. Simple as that. Or I think you need to go out in a neighborhood where it's predominantly what you want and then work there. I don't think it's fair to us as people, period. Now, I'm talking about as people, period, definitely as African American people. I don't think it's fair to us that they should be doing sneaky stuff to us that we have no clue about because they hate us. I just, when I say the word they hate us, like it's hard for me to really wrap that around my mind because how can you hate somebody just because the color of their skin, because you don't know them, they never did anything to you, but yet you can't stand them. How do you, I mean, oh, I just don't know. But I know one thing: the doctors and stuff need to really step their game up for real, because I bet you I'm not the only person that feels like this.
Have you talked to other people that have said the
Yes,
same?
I've talked to other people who said they don't trust them, period. Like, and then with a lot of people, parents and family members going in there and dying from COVID, and how they just so nonchalantly tell you that your family member didn't pass, and you couldn't even be there to just kiss them and say I love you and hold their hand and stuff like that. I get that, but then you as a caregiver is the only one can be there with them. Can you please? I mean, like you almost got to say, can you please help my family member? Can you help save their life? Can you just tell them that I love them? And these is people working with them that ain't gonna tell them nothing. You know what I'm saying? Probably can't wait till they die. Like that bothers me a lot.
But Lisa, you don't know that that's the majority of the people.
I
I mean, clear. I mean, clearly, there's been signs that you mentioned a nurse. I mean, so clearly there are some just like you described. But do you think that's the most? That's most healthcare
No,
professionals?
I'm not saying it's most healthcare professionals, but I don't know how to pick them out. You know what I'm saying? I don't know who I'm dealing with. So until I see something different, you know, my trust level probably is going to stay where it's at, because for one thing, I know they ride for each other. So you don't
Mm.
know who is what. Everybody walking around slapping high fives and doing whatever they want to do. It's just crazy. It's crazy. The medical field is really off the chain right now for me. I think they off the chain. I seen the news clipping where a dentist then rode on a hoverboard, taking out this patient's tooth, letting the nurse do it, while he didn't put the patient under sedation without her permission, and he riding around on a hoverboard like it's nothing. Like, My life is in your hands. You got me under some type of strong sedation, and you letting a nurse extract my teeth while I'm out, and you riding around on a hoverboard like this is a joke. No, what is wrong with you?
Mm-hmm. Mm-hmm.
So yeah, Dr. Rahman, I don't know. I don't know. I really don't. Maybe my next doctor, I'll be able to feel like I can trust them, and that I'm comfortable with them. That's what I'm looking for now. I'm looking for a different doctor, and I'm
Yeah,
look
that makes sense. That sounds like the first step. You need to establish a relationship with the doctor that you
correct.
trust. I mean, you said that once you know that you can trust the doctor, then you're more willing to go along with whatever they tell you.
Correct, because that doctor I got, honey, please, I wouldn't trust what she tell me to do no further than when I walk out that room, and she don't come in the room. So, yeah, I'm looking for a new doctor right now. Somebody I could trust, and this time I'm doing reviews, I'm doing bios, I'm doing it all this time. I'm not just going to let somebody give me a doctor and I'm not comfortable with them and I don't have no type of relationship with them, but they making choices for my life. No, we going to have to be better than that. We going to have to be better than that.